Today, we're diving into a piece of medical technology that many of us have heard of and maybe even experienced, but don't really understand. I'm talking about the CT scan. It's a true cornerstone of modern medicine, and we're about to take a journey to see exactly how it lets doctors peer right inside the human body. I mean, think about it for a second. It's a wild thought, right? How can a doctor get a perfect, crystal clear look at your brain or your lungs or your bones, all without ever using a scalpel? Well, that's the big question, and that's exactly the puzzle we're going to solve. And here it is. Here's the answer. It's called computed tomography, or CT for short. Now, to put it simply, a CT scanner is a really sophisticated X-ray machine that takes pictures from all different angles around your body. Then, a super powerful computer takes all that information and builds these incredibly detailed cross-sectional views. You can think of them as individual slices of you. So here's our game plan for this journey. First, we'll get our heads around the basic idea of the see-through slice machine. Then, we'll look at how technicians dial in the perfect image. We'll cover all the important stuff about safety and prep. After that, we're going to take a quick tour inside the body itself, and we'll wrap it all up by seeing how those 2D slices build these stunning 3D models. Okay, first up, the see-through slice machine. Before we get into all the nitty-gritty technical stuff, let's just make sure we grasp the fundamental magic here. What makes this whole thing even possible? Okay, the best way to think about this is to picture a fresh loaf of bread. Now, if you wanted to see what the very middle slice looks like, you'd have to cut it, right? But what if you could see a perfect, paper-thin image of that middle slice without ever touching a knife? That's exactly what a CT scan does for your body. It can show your doctor any slice they need to see, giving them this incredible, non-invasive view inside. So how do we get that perfect slice? It's not as simple as just hitting a big scan button. Getting a high-quality CT image is a real science, and the technicians have a whole control panel's worth of settings to tune the scan for exactly what the doctor needs to see. And one of the most important dials they have to turn is the slice thickness. It's all about a trade-off. Fixed slices are great for getting a general overview of an area, and they use less radiation. But if a doctor is hunting for, say, a tiny nodule in the lung or a hairline fracture in a bone, they need thin slices. This gives you that incredible high-resolution detail, even though it does mean a slightly higher dose of radiation. It's all about using the right tool for the specific job. And it goes way beyond just slice thickness. Technicians have this whole toolkit. They're adjusting things like kV and MA. You can think of that as the power and the brightness of the X-ray beam. They set the field of view, or FOV, which is basically them zooming in on the exact part of the body they need to investigate. They even apply digital filters to sharpen the image to see bone better or soften it to see tissues and organs more clearly. And finally, the radiologists use window and level controls, which are like super advanced brightness and contrast tools to make very specific things pop right out of the image for a perfect diagnosis. Okay, so we get the machine. Now let's switch gears and talk about the patient experience. What actually happens before you even get near the scanner? Well, this part is all about making sure the whole procedure is as safe and as effective as it can possibly be. Look, safety is priority number one. It's absolutely non-negotiable. Before any scan, the medical team runs through a detailed checklist. They're going to ask you about any allergies, especially to things containing iodine. They'll review your medical history, and this is critical, they'll confirm pregnancy status for female patients. Honestly, clear communication between you and the technologist is the key to making sure everything goes off without a hitch. That allergy check we just mentioned, a lot of the time it's related to something called a contrast agent. The easiest way to think of this stuff is as a special dye that acts like a highlighter for your insides. Just like this quote says, its job is to make things like blood vessels, tumors, or areas of inflammation really stand out, helping doctors immediately tell the difference between what's normal and what might be a problem. And it's really important to know that not all contrast agents are created equal. The older kind, called ionic contrast, had a higher risk of causing allergic reactions. And that's exactly why today, the gold standard is non-ionic contrast. It's just so much safer and way better tolerated by patients, which makes the whole thing a much more secure experience. Okay, prep is done, the machine is calibrated. Now it's time for the really cool part. Let's take a quick journey inside the human body and see just what this incredible technology can actually find. So, let's start at the very top.
In an emergency room setting, a CT of the head can spot a skull fracture in seconds after an accident. For your doctor, it can map out a really deep sinus infection or pinpoint the exact location of a tumor, which helps them plan a treatment with amazing precision.
Now, moving down into the neck, which is a really complex area, remember that contrast agent we talked about? This is where it really shines. It becomes like a roadmap, lighting up glands, lymph nodes, and blood vessels. This lets doctors track the path of an infection or figure out the exact stage of a tumor, which is absolutely crucial for deciding on the right therapy. And finally, we'll look at the chest, where a high-resolution CT can literally be a lifesaver. It is one of the fastest, most reliable ways to find a pulmonary embolism. That's a really dangerous blood clot in the lungs. It can also spot tiny little lung nodules long before they'd ever show up on a normal X-ray, giving patients a huge head start on treatment. But the journey doesn't stop with those flat 2D slices. No way. This is where things get really, really futuristic. Let's take a look at how all of that data gets transformed to build a virtual, three-dimensional model of you.
So here's how it all works broken down. First, the scanner acquires the raw data, and we're talking hundreds, sometimes even thousands, of these super thin image slices. Then a powerful computer takes over, digitally stacking and aligning every single one of those slices perfectly. And finally, the software renders all of that 2D info into a fully interactive 3D model.
So why is this 3D model such a big deal? Well, for one, it means surgeons can basically do a dress rehearsal of a complex operation on a screen before they ever make a single cut. It gives doctors this crystal clear understanding of a patient's unique anatomy. They can even do what's called a virtual bronchoscopy, where they can basically fly through a digital model of the lungs to find the exact location of a cyst or a tumor. It's amazing. And the technology itself has just evolved at a breathtaking speed. I mean, we've gone from these really slow single-slice scanners to the super fast, high-resolution spiral scanners we have today. And the future is already here, with AI integration promising even faster scans with even less radiation. Just let that sink in for a moment. Less than 1 second. That's how fast some of these modern scanners can work. In the time it takes you to snap your fingers, the machine can capture a complete, detailed picture of an entire organ. And that incredible speed means more comfort for the patient and, you guessed it, much sharper images for the doctor. And this isn't some science fiction movie. This is happening right now. Artificial intelligence is already being built into the newest CT scanners. These smart algorithms are helping to lower radiation doses, speed up the scans, and they even act like a second set of eyes for the radiologist, flagging subtle things to help make diagnoses faster and more accurate than ever before. So we'll end with this thought. The CT scan completely transformed medicine because it gave us this clear window into the living human body. And as that window just keeps getting clearer and faster and safer, it really makes you wonder, what's the next great medical mystery that this incredible technology is going to help us solve?